Hi, I'm Dr. Jason Wagner with Sarasota Vascular Specialists, and thank you for joining me for another Whiteboard Wednesday. Today, we're going to talk about the important relationship between a vascular surgeon and their patient when it comes to dialysis access creation and management. This is a lifelong, long-standing, back and forth, good communicating relationship between the vascular surgeon, the patient, the vascular surgeon in the dialysis unit and the vascular surgeon and the patient. It's very important to have communication be key because we need to know when things are working well for the patient, when they're working well for the dialysis unit or the dialysis providers, and what we need to do and respond to it quickly if there are any issues. So the first step in the relationship is really the first evaluation and the creation of the access. Do you want to do peritoneal dialysis, where that's something you can do at home at night and you not have to go to a dialysis unit? Or do you want to do in-center hemodialysis, where you're going to the dialysis unit a couple times a week and being hooked up to machines that way? We're going to get ultrasounds. We're going to figure out what the veins and the arteries look like, and we're going to plan to create a fistula or graft in the arm. The next step's going to the operating room, creating the access, establishing a way of having hemodialysis be provided for a fistula or a graft. What we're going to do is we're going to create the access. We're going to see you back in a couple weeks, check the incision, make sure things are healing up appropriately. Then after that, we're going to get an ultrasound and make sure there's enough flow going through the vein or through the graft that it's suitable for dialysis use. We're going to then give you a form that says, okay, this thing's ready to go, ready to use dialysis. Also, we need to make sure that the dialysis unit nurses and technicians are using it without a problem, because I could build the most beautiful fistula or the most beautiful graft, but if the dialysis nurses are having a problem using it, then it doesn't matter how good it looks if it can't be used correctly. So we got to make sure that's working well for the patient and for the dialysis unit. And if we start finding a problem, be it a narrowing in the outflow, we want to repair it or treat it proactively. We don't want to just let it clot off and then plan for a new access as a one and done. No different than if you have a new car and you're driving it for a while and your tires start to wear out. You're not just going to, trade in your car for a new car or just throw away the car, park it and never drive it again. You're going to get new tires, or you're going to change your belts, or change your oil, do different things. But that relationship between the vascular surgeon and the patient, it's not just, okay, I'm going to tell you what we're going to do. I need you to tell me what works for you. I need to know, okay, yeah, like I really don't want to use this arm for this reason, or I know I'm right-handed, but I really want to use my right arm because of whatever reason. It's a good communication, because I want to make sure, and all the vascular surgeons want to make sure, that whatever access we're creating or whatever we're doing to help you prolong your life and help replace your renal function with a dialysis graft, fistula, or peritoneal catheter, I need to make sure that it works for you, not just from a functional perspective, but from a social and overall use perspective. The relationship between a vascular surgeon and their patient isn't just, you come, you get a procedure, and you're done, and I'll see if you have a problem. It's about surveillance, about maintenance, about future planning. I'm Jason Wagner, Sarasota Vascular Specialists, and thanks for joining me for a Whiteboard Wednesday on dialysis access.
Thank you.